at once. But there's the United States spending a little bit more than most other countries except Switzerland. And there are a bunch of other OECD countries. I just put out a random set of them from the OECD. These are all relatively rich OECD countries. I didn't put out Mexico and Turkey and places like that. So these are at least countries that we compete with, think about as kind of peers in the world. And you can see that back in 1976, there was a pretty big spread in life expectancy at age 40 among those countries. And the United States was pretty much in the middle of the pack. Our spending was a little bit higher than average. So here is the same picture in 1986. Countries are still spread out. The US has now ascended to spending the most money. Sort of still in the same place with respect to life expectancy. The countries are very spread out. Here's 1996. Here we are pulling ahead of the crowd. And there are all the other countries. And here is 2006. All right. There are some amazing things about this picture. All right? One of the amazing things about this picture is how badly the US does compared to all these other countries. So here is the dot that we had before. The United States is indeed spending more and doing better. We're doing better, right? But other countries are spending less more, and they're doing more better. Something is wrong with what we are doing here. The other thing I want you to note, though, and this is really important because I have Victor in the room, these countries have completely different healthcare systems from one another. We in the United States always say the United States compared to the rest of the world. The rest of the world is not one country. The rest of the world is a lot of different countries. And if you said to people in Switzerland, you have national health insurance, just like in the United Kingdom, they would laugh you out of the room, right? These countries have radically different healthcare systems. Some of them have private health insurance. Some of them only have public health insurance. Some of them own their doctors. Some of them contract with their doctors. Totally different healthcare systems. What is astonishing is how similar their performance is, both in terms of life expectancy and in terms of cost, and how badly the US does compared to the